Okay, so hello everyone. My name is Nur Sarah Ilyana, and today I'll be presenting a topic premenstrual dysphoric disorder (PMDD). In this slide, I'll be explaining what is PMDD. So PMDD is similar to premenstrual syndrome (PMS), but premenstrual dysphoric disorder, which is PMDD, is more significant health condition. The week or two before your period begins, you may experience acute irritation, sadness, or worry. In spite of the fact that PMDD has both physical and emotional symptoms, but PMS does not. A woman's period-related symptoms begin 7 to 10 days before the start of her monthly cycle and last for the few days of her period. So, who can get PMDD? Many women who suffer from PMDD may also suffer from anxiety or despair as a result of the condition. Between 3 and 8% of women of reproductive age are affected with PMDD suffer with symptoms that interfere with their normal ability to operate normally in their everyday lives. But what causes PMDD? PMDD has an unknown etiology. Each menstrual cycle brings about hormonal changes that may cause an inappropriate response. In the brain and intestines, serotonin narrow blood vessels affecting mood and causing physical manifestations. What are the symptoms? So, PMDD symptoms are divided into 6 symptoms, which is psychological symptoms, gastrointestinal symptoms, neurological and vascular symptoms, fluid retention, respiratory problems, and eye complaints. So I'll start with the first symptoms, which is psychological symptoms. In these symptoms, you can get irritation or sense of helplessness, you'll get irritated easily, you'll get moodiness, sleep problems, frustration, insomnia. You'll also have the increase of insensitivity or fluctuations in mood, confusion, forgetfulness, and you can also get depressed by having MDD. As for the slides, it consists of other type of symptoms, which is gastrointestinal symptoms. You'll get abdominal cramps, bloating, constipation, nausea, and vomiting. And for the neurologic and vascular symptoms, you'll get headache, dizziness, fainting, easy bruising, and heart palpitations. For the fluid retention, you'll get swelling of the ankles, hands, and feet. Also, period being weak, or you can also feel the breast fullness and pain. Lastly, respiratory problems, which you can get allergies and infections. In addition to bloating and breast discomfort, both PMDD and PMS can produce tiredness and changes in sleeping and eating patterns. One of these emotional and behavioral symptoms, however, stands out in PMDD, which I have explained just now: the gastrointestinal symptoms, psychological symptoms, neurologic and vascular symptoms, fluid retention, and respiratory problems. So here's to how can it be treated. First thing is you have to change your diet to boost your protein and carbohydrates. You also need to decrease sugar, salt, caffeine, and alcohol are among the most common. You also need to exercise regularly, consume vitamin supplements such as B6, consume antidepressants or birth control. You also need to find relaxing activities that relieve tensions, such as reading, watching movies, going for a walk, or having a bath. Or maybe you can talk to a partner or a trusted friends, acupuncture, or maybe you could do yoga to relax your mind and to help the flow go smoothly. Okay, so here's the next step of or maybe tips to help you get the most from a visit. to your healthcare provider. First thing, you have to know the reason why you are visiting and what you hope to accomplish. Also, ask your doctor if there are any alternative treatment options for your problem, and educate yourself. Please educate yourself on the possible consequences of avoiding certain medications, tests, and procedures. Last but not least, please jot down. This is a very important tips. Please jot down almost every important advices from your doctor. An example like um, the names of medicines, what are the causes, and what are the treatments you need to do. And if you have a follow-up doctor appointment with the healthcare provider, please jot down and please jot down the date and go to the appointment right on time and do not miss the appointment. So that is all from me about PMDD, premenstrual dysphoric disorder. I'm gonna end here and thank you so much for listening. Thank you.